I was approached by Dr. Hodges and Dr. Gilbert and Dr. Khalid. We were in the middle of a merger of 3 surgeries into Aspen, and I was the district nurse lead covering their patch, and they were given some money to look at frailty and asked me if I'd be interested in coming in and looking at the frail elderly population, initially at the high intensity users and the sort of more tricky patients, to see whether we could reduce the burden for GP home visits and see if we could get some more integrated care going for these patients.
So we've got just over 31,000 patients now, and we have a very high prevalence of chronic diseases across the board, and also quite a above average proportion of our patients are older and more frail. We're real believers in integrated care. So by integrating as much as you can within one organisation, you can have a policy where any door is the right door. And that's how we like to work.
We can help people to get the best support for whatever their problem might be. So we liaise an awful lot with Age UK, adult social care, and we can work closely in an MDT style and point people in the right direction and make sure that they get all the support that they need and that's available for a really holistic care package, if you want to call it that.
What we do in Aspen particularly is we do a virtual ward round once or twice a week. So we'll have a look at the traffic in and out of the hospital, and if we send someone in, we'll track their progress through the hospital and out the other end. If they're complicated, we will liaise with whichever ward they're based, and we'll offer to come in, or sometimes we'll be invited into MDTs and discharge planning. Equally, we will pick patients up that we've never seen before, so we're actively seeking out these elderly patients on discharge, making sure that they get that wraparound service when they leave hospital. Having access to that service actually it reduces any delay in medication and follow-up post-discharge, but it also fulfills patients with a lot of confidence that we are offering them that wraparound service.
All the way through, the people who have been taking care of me have always told me the truth and helped me. I think they're very competent and very well trained and had the knack to talk to people.
Everybody's problems are different and everybody's perception of their problems is different. And the way that we handle them are different depending on the person. There is no straightforward answer. It's what does that person want and what is going to help them to achieve that. So you've got to really dig into their way of life, their culture. So yeah, different for everybody.